Acne is known by various names: pimples, whiteheads, blackheads, bumps, nodules, cysts, a lot of names that we know of. But yes, majorly acne. It is basically a chronic inflammatory condition of skin and something known as a pilosebaceous gland in the skin. But yes, in a broader answer, it is an inflammatory, chronic inflammatory condition of skin which gives rise to the bumps on various parts of the body. Acne can be of various types. One way to know the type of acne is the severity, the grade of acne. So there is something which is first stage of acne, which are just comedones, just whiteheads and blackheads. And from that to grade 4, which is very severe acne, where you have nodules and cysts and pus in those nodules. So one way to know the type of acne is grade 1, grade 2, grade 3, grade 4 type of acne. The other way to know is location. There is facial acne, there is truncal acne, acne on the chest, acne on the back, acne on the buttocks. There is jawline acne, which is hormonal acne. So there are these gross types of acne. There are 5 major points that we need to discuss. The first, again, is lifestyle. So again, I'll give you the example. If there is an apple which has gone bad from inside, its peel is not going to look good from outside. So we have to understand that if you want to be healthy, if you want to have healthy skin, you have to be healthy from inside. And so lifestyle again includes 3 points: exercise. So 45 minutes to 1 hour of whatever exercise that you want to do, sweat it out. Be sleep. Again, 8 hours of uninterrupted sleep is magical for your skin. That's why it's called beauty sleep. And then the third thing, when it comes to diet in acne, we usually tell you what not to eat. So with hair, we tell you what to eat. With acne, we'll tell you what not to eat. So as I mentioned, it's an inflammatory condition of skin. You don't want to eat foods which are pro-inflammatory, which increase inflammation in the skin and the body. Out of which the first one is dairy. So all the dairy products, milk, lassi, tea, coffee, paneer, curd, yogurt. So all of these are very inflammatory food items. And we Indians are obsessed with dairy. So it's sort of a heartache when you come to know that, my dairy products are causing my acne. But dairy is the worst food item when it comes to acne. Second, of course, is again alcohol and smoking, because alcohol and smoking is always bad for your skin and your hair. Third thing is hormones. So acne is a hormonal condition. If you have a hormonal disturbance in the body, it is going to show on your face. Though hormones, of course, circle you back to lifestyle, because the only way to keep your hormones under control and not have any hormonal disturbance is if you have a good, healthy lifestyle. That's when your hormones are going to be proper and there is not going to be any disturbance. But yes, if you have some disease which is causing hormonal disturbance, it can always cause acne. The last thing is makeup products. So makeup per se does not cause a lot of acne. Improper removal of makeup is something which causes a lot of acne. You remove it in 3 steps. You use micellar water, followed by cleanser, followed by a face wash. So if we are taking care of all of these points that I've just mentioned, you will be able to prevent at least 80-90% of acne that is going to come. Also, all of these tips are for prevention of acne also. And when you're undergoing treatment, if you follow all of these, of course, your results are going to be quicker and faster, and it's going to supplement the treatment that your doctor is giving you. You should visit your dermatologist with the first sign of acne. I'll tell you why. Even if you don't do anything, your acne is going to go away. You also know that. I also know that. There is no acne which is there for years. It will go away. New ones might come, but they will also go away. So then the need for treatment, and I am saying urgent, I'm saying go when you have the first signs of acne, your blackheads, your whiteheads, your early acne. I'll tell you why. We don't treat acne just because it's cosmetically disfiguring. We treat acne because it leaves behind scars. So both the things are very very important. So I have an acne prone skin. Okay, I'm an acne patient myself, but of course I'm a dermatologist now. I've been a dermatologist for the past 12 years. I've not had a single acne in the last 12 years. Zero. Why? Because of all the lifestyle changes and everything that I just discussed. I follow them to the T myself. But because I had terrible acne when I was a teenager, and my parents were not aware, we were not aware, the generation was not such, we did not seek treatment at that point. And so I have scars on my face which are permanent. And I can't do anything about it. I can only reduce them, they don't go away completely. So, the reason why acne needs to be treated early at the first sign as an emergency to your dermat is to prevent permanent scarring on the face or any other body area. So acne treatment is very variable. It is a very customized plan for every patient. It depends on your skin type, on your type of acne, on your feasibility of how frequently can you visit the doctor, how what are the medications available in your area, a lot of things. But yes, if you ask me, like in general, there are oral medications, there are antibiotics, there is isotretinoin, then there are topical creams, a lot of them, benzyl peroxide, azelaic acid, retinol, endless. The list is endless now. And then there are procedures that we do. We do chemical peeling, we do intense pulse light, something known as IPL, we do Q switch Nd:YAG lasers, we do a lot of these red light therapies, we do so many treatments, procedures. Also, all of this with the foundation of lifestyle change that I just mentioned. This is like a complete plan, but of course, it depends on patient to patient and doctor to doctor for that matter. I don't support home remedies for acne treatment. I'll be very honest. I'll tell you the reasons. Just frankly, just 3, 4 days back, I had a patient who had like a proper dermal burn on the left cheek because of aloe vera juice that he had extracted himself from the plant that was there in his own house. But I feel that natural products, botanicals, should also be purified and then put on the skin, because we have endless things. People will put curd and lemon and besan and neem and everything, like every possible thing. But then we don't know how it's going to react on your face. Few of them are very harsh. Neem is an antiseptic, I know, but it is so harsh that it damages your skin also. So we have to understand that home remedies are usually not that effective, and b, if at all they are strong enough to be effective, we don't know what complication can happen. So I would always advise to have, you know, products which are simpler products. If you don't want to go too deep into skincare, there are basic simple antibiotics to put, things which are tested and tested in labs, tested in humans with generations of literature on them. I'll always be in favor of that in over home remedies.